Have you ever found yourself stopping halfway up the stairs after just a few steps? Clutching the handrail, heart racing, wondering, what's happening to my legs? The truth is, after age 60, climbing stairs becomes a serious challenge for millions of older adults in the US, not because of a lack of muscle, but because the brain and muscles no longer communicate as smoothly as they used to. What's truly remarkable, however, is that in Japan, many seniors continue to go up and down stairs every day with ease, without any assistance, thanks to one powerful secret: retraining the connection between the brain and muscles through simple, home-based exercises. In today's video, I'm Dr. Emily Carter, a physician specializing in adults over 60 here in the US, and I'm going to show you 3 at-home exercises that restore strength to climb up, control to go down, and lateral stability to stay balanced, all based on a proven strategy the Japanese have used for decades. If you're ready to reclaim confidence on every step, stay with me until the end of this video. And if you're committed to making a change, leave a comment below that says, "I want to start today." In the United States, over 32% of adults over 60 report difficulty climbing stairs. According to the CDC, stair climbing is one of the most common daily activities linked to dangerous falls in seniors, especially among those with muscle loss, knee pain, or balance issues. But here's what most people don't realize. Stair difficulty isn't just about weak legs or aging joints. One of the most overlooked causes is a breakdown in brain-muscle communication, a phenomenon researchers call neuromuscular deactivation. When the motor cortex, the part of your brain that sends signals to your muscles, fails to activate key groups like the quadriceps, gluteal muscles, or hip stabilizers, you might know how to climb stairs, but your body doesn't respond in time. That leads to missteps, near falls, or shaky, hesitant movement. A 2021 study published in the Journal of Geriatric Physical Therapy revealed that neuromuscular disconnect increases significantly after age 60 and accelerates even faster past 70 without targeted intervention. Moreover, the JADIS study in Japan found that older adults who did not train their brain-muscle coordination had 2.4 times higher risk of stair-related falls. This means that to climb stairs safely, it's not enough to just strengthen your legs. You must retrain your neuromuscular system, something most YouTube workouts today still fail to address properly. For decades, Japan has led the world in mobility and independence among the elderly, even those well into their 80s. Their secret doesn't lie in supplements or gym machines, but in a movement philosophy called Shinkeikai Kinniku Renshu, which translates to neuromuscular re-education. Rather than focusing solely on building muscle, Japanese seniors practice precise coordination between the brain, nerves, and musculoskeletal system, the 3 pillars that determine how your body responds to stairs. In a 2018 study by Osaka University, older adults who performed neuromuscular exercises 3 times a week for 8 weeks saw an average 18.7% increase in leg strength, a 41% reduction in stair-related fall risk, and up to 28% improvement in motor reflex speed. These findings were confirmed in 2020 by the Tokyo Metropolitan Institute of Gerontology, which reported that seniors engaging in brain-muscle coordination training maintained nearly 30% better balance than those who only did traditional strength training. What sets their method apart is how every movement begins with intentional brain activation, starting with breath, mental imagery, and only then the physical motion. As the Japanese saying goes, if the brain doesn't issue the right command, the muscle will never perform it correctly. This foundational shift in how they activate the neuromuscular system is what enables Japanese seniors to climb stairs smoothly, confidently, and often without needing handrails, even into their 80s. Before starting any exercise to improve stair climbing ability, there's one step I always require my patients over 60 to perform, even though it only takes 2 minutes, and that is activating the neuromuscular system. This isn't your typical warm-up meant to stretch muscles. It's a strategic activation phase designed to reconnect the brain with key muscle groups before movement begins. If you skip this step, the effectiveness of your workout may drop by at least 40%, according to analysis published in the Journal of Neurologic Physical Therapy in 2022. The warm-up I recommend is a controlled movement called March in Place. Simply stand tall and lift your knees alternately for 60 seconds. The most important part? Every time you raise a knee, gently tap it with your hand and visually focus on the leg in motion. This enhances proprioceptive feedback and strengthens your brain's attentional engagement with the muscles. Next, spend 30 seconds with your eyes closed and visualize yourself climbing stairs. Inhale as you lift the leg, exhale as you lower it. This technique is called motor imagery, and a 2020 study from the Cognitive Neuroscience Journal showed it can increase neuromuscular reflex speed by up to 28% and significantly improve balance in adults over 65. This is one of the most powerful differences between traditional Western exercise and the Japanese philosophy of brain leads first, muscle follows. And if you want to get the most out of the 3 upcoming exercises, never skip this deceptively simple but neurologically strategic warm-up. Exercise 1. Wall sit. Restore strength for stepping up. Now that your body is properly activated, we begin the first and most essential exercise for restoring strength to climb stairs. I often remind my patients, if you don't have the power to lift your body onto a stair, no amount of balance or control going down will matter. The primary muscles responsible for upward stair movement are the quadriceps and gluteal muscles. One of the most effective and low-risk ways to activate both of these groups at home, without any equipment, is the wall sit. To perform it correctly, stand with your back against a wall, feet shoulder-width apart, and about 12 to 16 inches, 30 to 40 centimeters away from the wall. Slowly slide your back downward until your knees are at approximately a 90-degree angle, as if you're sitting in an invisible chair. Hold this position for 15 to 30 seconds. Breathe steadily, then stand back up and repeat for 3 to 5 sets. If you're new, start with shorter holds and build up gradually. A study published in the Journal of Aging and Physical Activity in 2019 found that seniors who practiced the wall sit 3 times per week for 4 weeks experienced an average 15% increase in leg press strength, enough to make a meaningful difference in stair climbing without relying on handrails. Unlike regular squats, the wall sit provides more joint stability and is knee-friendly, allowing you to focus on sustained muscle engagement. To enhance neuromuscular activation, I recommend visualizing yourself climbing stairs while holding the wall sit. By aligning mental imagery with physical sensation, you're not just building strength, you're also retraining the brain-muscle connection, exactly as practiced in Japanese neuromuscular methods. And if you commit to doing wall sits daily, you can expect to feel a noticeable return of upward power in your steps in as little as 3 weeks. Exercise 2. Eccentric step down. Restore control for stepping down. If the first exercise helps you generate power to step up a stair, then this second one is all about regaining control when stepping down, a skill that most adults over 60 gradually lose without even realizing it. In fact, according to a 2021 report in the Journal of Geriatric Orthopedic Surgery and Rehabilitation, over 60% of serious stair-related falls occur while descending, not ascending. The reason is that stepping down requires your body to slow itself down against gravity, not push upward. And that job relies heavily on your hamstrings, gluteal muscles, and, most importantly, the cerebellar control system, which governs how your brain slows down movement with precision. The exercise I'm guiding you through today is called the eccentric step down, which targets the eccentric phase of muscle contraction, when your muscles must generate force to resist gravity during downward motion. To perform it, all you need is a small step or platform about 4 to 6 inches, 10 to 15 centimeters high. Stand firmly on the platform with one foot and slowly lower the opposite foot toward the floor. But don't let it drop. Instead, control the descent over 3 to 5 seconds. Maintain your balance, then return to the starting position. Repeat 10 times on each side. Take your time. The key to this movement is slow, controlled lowering. According to a 2020 study from the University of British Columbia, adults who performed the eccentric step down 3 times per week for 6 weeks improved their descending controllability by 24% and significantly reduced instability while stepping down stairs. This is a result that standard strength training alone does not typically produce. To enhance neuromuscular coordination, try mentally counting 1, 2, 3 during each descent while focusing on the gentle tension in your hamstrings and glutes. This helps your brain recalibrate the motor control signals and rebuild natural reflexes needed for safe stair descent. After just a few weeks of consistent practice, you'll begin to feel a renewed sense of control and confidence with every step down, instead of that slipping, unstable sensation you may have grown used to. Exercise 3. Standing hip abduction. Strengthen lateral stability for balance. The final movement in this 3-part strategy to restore safe stair climbing after age 60 is the standing hip abduction, a side leg lift that targets the hip stabilizers, specifically the gluteus medius muscle. This exercise is critical because it strengthens the side of your hip, which plays a central role in single leg balance, weight transfer, and stair movement, both up and down. When this muscle is weak, you're more likely to tilt your body, drop your hip, or even trip when your non-supporting leg fails to stabilize. According to a 2017 study published in the Journal of Orthopedic and Sports Physical Therapy, over 70% of adults over age 65 show signs of gluteus medius atrophy or weakness, and this group is 2.8 times more likely to experience fall-related injuries than those with healthy lateral hip strength. The good news? Just 3 to 4 weeks of proper standing hip abduction practice can lead to up to a 26% increase in lateral hip strength, along with significant improvements in postural control during movement. To perform the exercise, stand tall next to a sturdy surface, like a counter or chair for balance. Slowly lift one leg out to the side, without leaning your torso, and hold the position for 2 to 3 seconds. Then return to the center. Perform 10 to 15 repetitions per leg. Keep your core engaged and your standing legs stable. For added neuromuscular benefit, look directly at the moving leg as you lift it, which enhances visual motor integration. You can even progress the challenge by adding a light resistance band around your ankles after mastering the movement. This is how Japanese seniors maintain a stable pelvis and upright posture, allowing them to climb stairs without relying on handrails, even well into their 80s. And if you stick to this routine daily, you'll likely notice yourself standing taller, swaying less, and feeling more secure in every lateral movement, whether stepping up, stepping down, or simply walking across the room. To perform this exercise, stand upright next to a sturdy chair or counter for balance. Slowly lift one leg out to the side, making sure not to lean your body. Hold the position for 2 to 3 seconds, then gently lower the leg back down. Focus on keeping your torso upright throughout the movement. No tilting to the opposite side. Repeat 10 to 15 times on each side. The goal isn't to lift the leg high, it's to move correctly and with control. To further enhance the brain-muscle connection, I recommend looking directly at the moving leg and mentally picturing your hip as a solid pillar supporting your entire body. Once you're comfortable, you can add a light resistance band to increase the challenge. This is exactly how Japanese seniors maintain pelvic stability during movement, allowing them to climb stairs without holding onto a rail. And if you practice this exercise consistently every day, within just a few weeks, you'll notice yourself standing more upright, reducing hip drop, and feeling more confident with every step, something many believe they've permanently lost after age 60. Before you begin the full sequence of these 3 exercises to restore stair climbing ability after 60, I want to take 2 minutes to share some critical medical advice and safety warnings. These ensure your practice is effective and injury-free, something far too many exercise videos on YouTube tend to overlook. First, if you have a history of advanced knee or hip osteoarthritis, have previously suffered a pelvic fracture, or are currently experiencing joint effusion, you should not attempt wall sit or step-down exercises without being evaluated by an orthopedic specialist or physical therapist. Deep knee bending and sustained holds can increase joint surface pressure by 5 to 7 times your body weight. According to a 2020 study published in the American Journal of Sports Medicine, which can aggravate existing cartilage damage if not properly monitored. Second, if you suffer from neurological balance disorders, have had a fall in the past 6 months, or experience symptoms such as tremors, blurry vision, or disorientation with posture changes, it's best to train under supervision from a caregiver or licensed therapist. The Journal of Neurology and Aging, 2019, reports that seniors with vestibular or Parkinsonian symptoms are 4.5 times more likely to fall during unsupervised exercise. Additionally, always wear non-slip shoes, avoid practicing on slippery or poorly lit surfaces, and never hold your breath while maintaining a position. Breath holding triggers what's known as the Valsalva maneuver, which has been shown to cause sudden spikes in blood pressure, a serious risk for anyone on vasodilators or with a cardiac history. Finally, after exercising, don't sit down right away. Instead, take 1 to 2 minutes to walk slowly around the room, drink a glass of warm water, and monitor your body for 10 minutes. If you notice unusual pain, muscle fatigue lasting beyond 48 hours, or any signs of dizziness, stop immediately and consult a medical professional. Remember, training done correctly leads to recovery. Training done incorrectly causes new injuries. And you deserve to be guided safely, scientifically, and in a way that respects your body after 60. Climbing stairs after 60 isn't just a physical challenge. It's a signal of whether your brain and muscles are still working in harmony. And as you've seen, with just 3 simple at-home exercises, done in the right order, the right way, and with the right strategy inspired by Japanese seniors, you can absolutely regain the ability to step up with strength, descend with control, and stay balanced with confidence, even if you once feared every stair. Hundreds of my patients have seen a transformation in just 3 weeks using this method, and I believe you can be next. If you're ready to dedicate just 10 minutes a day to yourself, leave a comment below. I'm starting today. And don't forget to subscribe to Senior Health Zone for upcoming videos on how to rebuild joint strength, prevent muscle loss, relieve knee pain, and avoid dangerous falls, all guided by doctors and backed by science. Remember, the staircase isn't your enemy. It's a test of vitality you are fully capable of passing.